chronic disease and the management of chronic disease links with chronic pain and the chronic pain management. And I think it's quite astounding that you wouldn't be consulted in that decision that has affected so many people. And also in terms of all of the wording here in relation to the patient-centred, the patient being centre of all decision-making. Person-centred coordinated care gives me the services I need, where I need them, is based in a full understanding of my life and my world, combined with the information and support that I need. It respects my choices, building care around me and those involved in my care. That is wonderful. That is what we want. That is what we want to achieve. And I cannot reconcile that with the withdrawal of Versatis without giving a clinical plan to the GPs, undermining the GP consultant-patient relationship and just leaving people in abeyance. I just cannot. And I think it serves to undermine what you're saying to us here today across other areas when decisions like that are made. And I would ask, finally, I would just ask for you to do anything within your gift that you could ask for a review of that decision where Versatis would be reinstated, to really listen to the people that are telling you the impact of that withdrawal.
Obviously, in addition to my stroke hat and being a geriatrician, obviously you're absolutely right. Pain is an important part of chronic disease. No one disputes that. I think there would probably be a feeling in the medical community, just to start the ball rolling, as it were, that our pain services in general probably need a little bit more investment. The model of that, what it should look like, probably needs to be multidisciplinary. The solution to all pain is not a pill nor a patch, but there are other aspects to this as well. The problem, I suppose, with a limited finance around it, and I'm not speaking on behalf of Professor Barry, he's very well able to speak on behalf of himself. The problem is, of course, that there's a finite resource around the issue. The problem is that, looking at it honestly as a medic, there's a huge gap in evidence here as to how this patch is working. Where it has a license for one thing, it has been used, and seemingly, I'm not doubting the testimonials of patients, that it is working in other areas as well. But that always poses a problem in medicine in terms of that when you're prescribing for something that you don't have a clear license to use it in. Should it be withdrawn from patients who are clearly benefiting from it? Definitely not. But to be fair, I don't think Michael Barry is suggesting it should be either. I think he's suggesting that he needs to have some sort of control over it in terms of how it's prescribed. Is it done maybe in a little bit hard way? My own personal view, maybe possibly. But if there wasn't, and I'm not aware whether there was or not, if there wasn't consultations with general practice, I don't think that's an ideal way to do business either. But I do think, in the general terms, we are a small country. We have finite resources, and I know the Minister has made an important move to get us involved with other smaller countries in Europe where we can get better bargaining power for our drugs, and that's a very important issue. But obviously there is a finite resource, and I think there has to be some sort of analysis if there's a huge overspend in a particular area.
Yeah, of course there has. But the cost-benefit analysis needs to take in the alternative medication, the home health, absolutely, the hospitalisation, and all of those things. And the very first thing that anyone needs to do is to go to the drug company and say, look at here, the volume has increased, give us a discount. And that wasn't even done. So that does not speak as being patient-centred to me. And I really would just ask you, and I know it's not your area, but I think it's connected to your areas, would you please just ask for them to have another look at that, to review it, and in the meantime just to reinstate the Versatis patches, and leave it to the GPs to make that decision, and leave it to the consultants